Welcome to the Inspired Hygiene Podcast. I'm your host, Rachel Wall. I'm an RDH and founder of Inspired Hygiene. For over 20 years, we've had the unique opportunity to see what really happens inside thousands of dental hygiene ops and what it takes to create transformational change that impacts the lives of patients, practice owners, and teams. Each season, we'll focus on one powerful topic, breaking it down with practical strategies, real stories, and tools you can use right away. Let's get into it. Hello, this is Rachel Wall. I want to welcome you back to the Inspired Hygiene Podcast. So today is a bonus session. You know, our podcast to this point has been structured in seasons. So we have multiple episodes around a particular topic. We have addressed some of the hot topics in hygiene, from compensation to hiring. That was season 1. We have talked about innovation and where teams must innovate to thrive going forward. We have really dug into perio and some of the areas that can be immediately optimized in the hygiene department in that regard. And so this is a bonus episode that we're dropping just to give you kind of a sense of where you might be able to utilize some insight from Inspired Hygiene to really make some plans for optimizing your hygiene department going into this next season of your practice. Whether you're listening to this with us at the first of the year, whether you happen upon this at any time of the year, these are things that are really going to be impactful. And so what I'd like to share with you today is the Inspired Hygiene System. So Inspired Hygiene has been helping teams elevate the services in their hygiene department, put in place clear systems, and bring their team all on the same page with calibration. And also, all of those things working together help create a win for the patients with better clinical outcomes, and for the team and for the practice with better business outcomes. And over the last 20 years of working with dental teams to do all of that, we have noticed a pattern that we implement these different frameworks that really help our clients achieve incredible results. You can look on our website, InspiredHygiene.com, and you'll see some case studies, you'll see client testimonials, and you'll be able to see for yourself what these clients are able to achieve and where they're really able to break out of the rut that so often dental hygiene departments fall into, and be able to really step into optimizing those clinical and business outcomes for everyone involved. And it really revolves around this Inspired Hygiene System. So we put this together a couple of years ago after really looking at what are the things that we really work with teams on that make such a big difference and really make all this tick. And we take a very holistic approach. So when we come in and work with teams, we're not only working on helping them develop a perio protocol. I know that's what we're known for, but we're also helping them improve their communication across the team. We're helping them develop, the hygienists and the dentists develop really clear systems for an effective and an efficient hygiene to doctor handoff so that it's consistent across all the hygienists, that the doctors are getting the information that they need, that the hygienists are feeling supported and empowered when they give that communication. And so we really want to address some of these things. And so what I'm going to do is I'm just going to review with you the different components of this Inspired Hygiene System. And then I'm going to give you some insight in each one of these categories of things that you can do in your practice to kind of either evaluate where you are and where there might be opportunities to refine, calibrate, grow, or things that you can take action on right away that are going to make an impact in your practice. So I'm going to start by just reviewing this. I also wanted to mention too, this came to mind because I am going to be presenting this Inspired Hygiene System as a 4-hour presentation this week. So I've been taking all of our knowledge, all the things that I've been teaching, and putting them into this format. And this is something that I'm going to be offering going forward. So if you are looking for a speaker for a study club, for your organization where you have dentists and dental team members there ideally attending together, then would love to chat with you about this and see if this might be a fit for your group. Before we dig in, let's review what all the different components are of this system. So first and foremost is always leadership. Next is mindset. Then we want to develop an empowered team that really feels like motivated and ready to move forward. We want to get the team calibrated, have a calibrated team, and then develop those clear clinical protocols. Next is communication, and then business processes to support all of this running smoothly. And then finally is the metrics. How do we know this is working? How do we know we're seeing progress? And where are the areas where we want to put our attention? So those are the different components of the Inspired Hygiene System. So now let's dig into this. So if you're watching on YouTube, you will have just seen that image of that Inspired Hygiene System. But that's okay. If you're listening, if you're in the car, if you're on a walk or something like that, I'm going to go through these with you here in a lot of detail. So what I envision in this 30 to 40-minute podcast is I want to give you, again, some actionable steps on each of these categories of the IH system. And we're going to start with leadership. So I'll tell you a story. We worked with a dental team. It was actually a group practice, so a multi-location group several years back. Fantastic leaders. They were very motivated to help their hygiene department develop really clear systems. But unfortunately, what happens many times with groups is they have business leaders that are really pushing them forward. But in the individual practices, they don't always have clinical leaders. Maybe they have associates. Maybe they have dentists that have sold the practice to the group, to the DSO, to the organization, and they're not really interested in leading the team clinically to improvement. They want to come in and do their work. They want to treat patients with the utmost level of care and expertise, but they're not really interested in managing and leading the team. And what this does, and in this particular example, is it was very difficult for them to see traction in the hygiene team because they didn't have a clinical leader for the hygienist to follow. So leadership is everything, and this is where it starts. Learning from that lesson, we learned a lot. We made some great progress with this group, but we learned a lot. And what we learned is that having a strong clinical leader is absolutely essential for a team to see results. And that is what we have learned. And so we look out for that as we're talking to different practice owners or leaders that reach out to us about coaching is, are you willing to be that clinical leader? The first step in really elevating the hygiene department is for the clinical leader to determine what are the core values of the practice and what do they want as a vision for the hygiene department. So when I'm speaking, I always ask teams like, what do you want the hygiene department to be for patients? What do you want the hygiene department to be for the team, for the hygienists specifically? And what do you want the hygiene department to be for the practice? And so we go through this exercise and everybody kind of shouts out different words. And then I say, okay, let's put this together because all those things that you shared are essentially your vision for the hygiene department. And then the next hard piece of leadership is to really look at the vision, look at those core values, and then to say, are we really fulfilling that? And if we're not, then that's where you have opportunity to grow. So any results that come from coaching or from your attention to developing the hygiene department must start with leadership first. Now, sometimes that's the hygienist, right? It's a hygienist stepping up and saying, hey, we need some help with calibration here. We have grown our hygiene department or we've had some changes in our staff and we're not on the same page. And so, hygienists, if you're listening to this and you're experiencing that, I encourage you to go to your clinical leader and say, we really would like to focus on all of us getting on the same page. Maybe you already have a hygiene handbook and you have a protocol in place, but maybe your whole team's not familiar with it or they didn't have an opportunity to give input. So, you can bring these things to the leader that can make decisions about where you're going next in the hygiene department, but leadership is critical. So my tip for you is to determine who is the clinical leader in your practice? Are you, as a practice owner, are you stepping into that role? Are you taking responsibility for the standards of care and the care that is happening in your practice? Are you making tough decisions when there are things that are blocking the level of care that you expect from being implemented, right? Now, let's take a step into mindset. That's the next piece of this system. So if the leader has decided, yes, it's time for us to work on hygiene, we want to really implement clear diagnostic principles, have clear communication in place, have a written standard of care, then you got to get your team on board. And all of us come with some bias, right, from our current and past experience. And sometimes what this looks like is, oh my gosh, even if we did recommend periodontal therapy, we don't have anywhere to put it in our schedule. We'll get to that in business processes. Or even if we were to present periodontal therapy, our patients aren't going to pay for that unless insurance covers it. Or how am I going to present periodontal therapy to these patients that I've been seeing for 10 years? And now you're just asking me to all of a sudden tell them they have periodontal disease. So those are really common mindset blocks, and it's important to understand that and be willing to take the time to overcome those things. And the first way to overcome these mindsets is to talk about it. And the second way to overcome these mindsets is to find a really strong why, a compelling factor that is much stronger than all of those other reasons. So that's where we come in and we really help teams develop that really strong why. Now, it could be really taking a deep dive into the oral systemic link and figuring out like, oh my gosh, like these patients having this chronic inflammation, even if I think I'm trying to address this in a prophy, it's not getting any better. And this chronic inflammation is likely creating risk for lots of other negative health impacts on these patients. So coming up with a why that is going to be stronger than the negative mindsets, the limiting beliefs that we've had in the past. Coming up with a compelling why that is going to be there for you, even when you're about to have a tough conversation with the patient that you've been seeing for 10 years. Um, and so really working on that mindset and really addressing those things that are holding you back and figuring out, are those things really true? Look at the patients that you've been surprised in your practice that have maybe done an implant case. Maybe it's a patient you didn't think had the financial capabilities to do something like that, and guess what? They did it. What about those patients that you've done a blood pressure screening on? They go to their doctor and the doctor says, man, the thing your hygienist checked your blood pressure, you're about to have a stroke. Okay. Those are all ways to shift your mindset from the patients won't do this to maybe they will. And it's our responsibility to give them the information about their health that is factual and to give them a solution and then to let them make the decision. Okay. So shifting that mindset is really critical. Sometimes the mindset shift is just from having a fixed mindset of this won't work to saying, you know what, I'm open to see how this will work. Maybe we haven't implemented something like this yet, but with the right tools, with the right communication, with the right education and a shift in our mindset, I think we can do this. Okay. The next step in this inspired hygiene system is creating an empowered team. So doctors, I'm going to give you some strategy here. A lot of times we have doctors say, I really wish my hygienist would tee up treatment more frequently or more consistently for restorative. And hey, that's a fair request. Doctors are coming out of multiple difficult procedures. Sometimes they've got multiple patients going at one time. They're coming in to do a hygiene exam. And, if there's nothing that's been discussed, they're trying to come up with this treatment plan like on the spot. And that's difficult to do. And a lot of times dentists will punt. They'll say, hey, it looks fine for now. We'll look at this again the next time because they're thinking about these other two patients. They're in the other operatory. Or maybe they're exhausted. Maybe it's the end of the day and they're just not prepared to have this long, drawn out, conversation with this patient about their restorative needs. But if the hygienist could have even planted the seed, had taken a photo, showed the patient the photo, started to increase that awareness, it shortcuts that process for the doctor dramatically. So doctors, in order for your team to do that, they need to know that you're ready and willing to empower them. Empower them with number one, permission to take that patient down the diagnostic path, and you can give them parameters and boundaries around that. Some doctors say, I would like for my team, my clinical team, the assistants and the hygienists to take that patient as far down that diagnostic path as possible, meaning educate them to what the problem is that they're observing, take a photo, point out what they see in the photo, and then maybe share with them a couple treatment options that I typically recommend. Obviously, doctor is going to confirm the diagnosis. This is not hygienists or assistants making diagnosis unless they're allowed to do that in their particular state. Okay. So, but first step is permission. Giving your team, hey, I want to give you permission to have these conversations with the patients and be very explicit with them on what that looks like. The second step is knowledge. In order for your team to be confident in teeing up treatment and starting these conversations, this co-diagnosis process, they've got to be really confident and comfortable in your treatment philosophy. So that means transferring that knowledge to your team, right? Picking a case, doing a case review once a month is, hey, let's look at this case together. Here's what this looked like before we did the crown prep. Here's what it looked like when I took out that old amalgam. You can see there's a crack in the floor of the prep, and I see this all the time with these types of fillings. Really educating your team what you're seeing so that they can start seeing it too. So they can feel confident in saying, hey, you know what I know is when we see this type of restoration with this type of decay, doctor typically recommends this. She's going to come in and confirm that, but that's been my experience in the past. So let's see what she recommends. Okay, so knowledge. And then the third piece of this strategy is accountability. So if you agree with your team, for example, that you're going to utilize one photo every time there's something that's treatment planned, then hold your team to that. Make sure they have the tools and the equipment to get it done efficiently. But if that's the case, then, in a pleasant way, hold your team accountable to that. If you come in to do the exam docs and that photo's not there, say, you know what, I'll be right back. Why don't you go ahead and take a photo of that number 2. So permission, knowledge, and accountability are leadership strategies that are really going to help your team feel empowered and help them act in that way. The next piece of the Inspired Hygiene System is having a calibrated culture. This really is why most practice owners call us. They want to get everybody on the same page. One hygienist is recommending periodontal treatment at this stage. One hygienist is not recommending it at all. And they're working in the same practice on the same patient base with the same doctors. So it's really, really critical to have everyone calibrated. Calibration can be anything from, hey, we're going to use the term non-surgical periodontal therapy instead of saying deep cleaning. That's one point of calibration. It also could say, this is how we're angling the probe when we're doing our periodontal readings. This is how we're calling out the information to patients. This is how we're preparing the patients for that periodontal assessment. That's also a point of calibration. So calibration is not a one point in time. Calibration is an ongoing effort to begin to get all of your team on the same page. I will say the number one resource that we can recommend for calibration is creating a written standard of care. Now, we facilitate this with our clients. We provide clinical resources that support standard of care that we recommend, but it's up to the dentist and the team to make the decision on what their standard of care is going to be. What is the frequency at which they're going to do a complete periodontal charting and record all the data? What is the point where they're going to move the patient from a prophy into periodontal therapy or into scaling in the presence of inflammation? Like, we can show them the recommendations from the AAP and different credible resources, but they've got to tailor that to their own treatment philosophy. So we have a resource for you. If you go to the Inspired Hygiene website and you look under free resources, you're going to see there's a standard of care document there. So I encourage you to go download that. You can use this as a guide to have this type of conversation and this meeting with your team to really develop that. That is a great and critical way to develop a calibrated team, is just to start with what are our diagnostic processes and what has to be true when we take a set of bite wings. In order for us to bill out a set of bite wings, what is the diagnostic criteria there? Get that in place so that everybody's calibrated on the same page. The next piece is clinical protocols. So then developing those clinical protocols that guide your everyday work. This, again, can be as broad as, going back to that standard of care and knowing when you're going to move a patient from a prophy into periodontal therapy. It can also be as detailed as, this is how we are doing our hygiene exam. these are the steps that we're going to use when we're doing our hygiene exam before we ever start scaling with that patient. This is our standard operating process for our hygiene exam. This is our standard operating process for our periodontal maintenance visits, so that there's continuity of care. Patients should be able to come into your practice and receive the same level of care across all the providers. Now, patients don't always know that, because number one, many times in dentistry and traditional practices, they're seeing the same provider over and over again, right? They're seeing the same hygienist over and over. So they don't know that hygienist A, is doing an oral cancer screening on them every time they see that hygienist. But hygienist B, who their husband is seeing, is not getting an oral cancer screening ever. And sometimes the hygienists are not communicating those things because they might assume that the other hygienists are doing all these other procedures and they're not. So that's where having an outside eye also helps to observe and see, like, what is actually happening here and how can we really get everybody on the same page for continuity of care for the patient. So clinical protocols, I would say one of the first pieces of clinical protocols is establishing what does it mean to do a complete periodontal evaluation. What are the data points that you're recording? We at Inspired Hygiene, we do chart audits all the time of our clients. And I will tell you what we see is that most practices now are recording pocket depths once a year, roughly. What they're not doing that is a critical missing piece is they're not recording bleeding. They're not recording recession. Very often they're not recording mobility or furcation involvement. And those are critical pieces to paint the whole picture of this patient's periodontal health. So if the patient has bleeding, it must be recorded in that periodontal chart. Otherwise, when you submit that to an insurance company for reimbursement, there's no sign of active inflammation if there's no bleeding on that chart. So that would be my recommendation of the very first clinical protocol to get in place is, what is our frequency of doing a complete periodontal assessment, and what is included in that process. Okay. Next, under clinical protocols, is communication. So communication is a critical piece of this system. If we can collect the diagnostic data, but we don't know how to communicate that to the patient, we don't know how to translate that into a treatment plan and communicate that to the patient, then we're kind of stuck, right? We're stuck with this diagnostic data, but we're not getting any closer to the patient being healthy. So communication is one of the things that we see very often on the surveys that we get back from our client teams is, what's an area of the practice that could be improved? And communication crosses all parts of the practice. When they say we need better communication, that could be the business team checking in patients when they arrive so the hygiene team knows that they're there, right? Let's say you're in a big practice with multiple wings, and it takes some time to walk up to the front. You're working on completing your notes and all of those things while you're waiting to find out if that patient has arrived. So that's a point of communication. Communication is also, how are the hygienists teeing up the patients to receive the information about their diagnosis, about the treatment that's recommended? How are they then presenting the treatment that they recommend? Another piece of communication is, how is the hygienist, we talked about this, how's the hygienist communicating to the dentist when they come in to do the exam, what's been discussed and what the patient's responses were? Communication could also be team meetings. Are we having team meetings? Are they effective? Are we getting to the bottom of the issues that we need to discuss at our team meetings? So we really take a holistic approach around this and even look at how are those things impacting the hygiene department, right? At Inspired Hygiene, that's our primary focus, is helping develop and grow the impact of the hygiene department. But nothing works in a silo in an organization, right? Everything impacts another part of the practice. So if there's poor communication or communication breakdowns when the hygienist walks the patient up to the business team and they've just recommended non-surgical periodontal therapy, but the business team has no idea, then that's going to impact hygiene's ability to deliver that treatment. It's going to impact the treatment coordinator's ability to put together a plan for that patient and get it scheduled, right? So even though there's pieces that might not happen exactly in hygiene everything in the practice. It impacts everything in the practice. And communication is a big piece of that. So my point of communication tip for you would be looking at that hygiene to doctor handoff. That is a super impactful part. And doctors, if you've got multiple hygienists, the hygienists don't know how the other hygienists are handing off to you. So if you're seeing inconsistencies, bring that up and say, hey, in order for us to have better communication, in order for our patients to accept treatment better, we would like to create some consistency between how that information is delivered from the hygienist to the doctor. Here's what we'd like to hear. You know, relevant medical history, what was discussed today? What did you complete today? And what were any recommendations that you made? Before we even launch into that, what images, doctor, do you want to have up on the monitor when you come into the operatory? That's a form of communication. So really work together on that and say, this is what we'd like to hear. Are you confident and comfortable delivering that to us? And giving your hygienist the permission to say yes or no. And if they say no, say, thank you for sharing that with me. What can I do to help you be more confident? And it could be your communication. It could be, hey, doc, every time you come in, you say, hey, you don't really give me the time to communicate that. And you say, all right, everything looks good. But I didn't get a chance to let you know that we actually discovered that this patient has periodontal disease. So hygienists, speak up, right? Um, if your doctor's asking you to do something from a communication standpoint and you don't feel comfortable, but yet you don't want to interrupt the doctor, like speak up, let them know. They need to know those things so that they can correct their communication as well and you all can work together. Okay, so the next piece is business processes. And this is a huge one. At Inspired Hygiene, we don't ever want to help improve a situation in the clinical part of the hygiene department, but then it creates a problem with the business team. I'll give you an example. Very often teams call us because they want to refine. They either want to establish a consistent, clear periodontal diagnosis and treatment protocol, or they have one, but they've had some changes in their team that's just not being implemented and they want to refine it. And so that's a really common thing that we work with teams on. And so let's say they're going from 9 to 59 quads of scale and root planning over the course of 2 months. This happens consistently because a lot of teams have periodontal disease in their patient base, a lot of it, and they just haven't had a clear system for how to diagnose it and how to present it to the patient so they will accept it. Some teams have not had anywhere to put this on their schedule, and that's a whole nother business process, okay? But let's say all of a sudden the hygiene team is doing a lot of more scaling and root planning. Well, it's got to be documented properly, or else what will happen is you'll get a whole lot of scaling root planning denials. So we don't want to fix a problem, right? Which was no diagnosis. We don't want to fix that and get all that ball rolling clinically unless we've got a plan for how we're going to address that from a business standpoint. So at Inspired Hygiene, we really work with teams on that clinical documentation that is going to support the claims. Whether you're an in-network or you're a fee-for-service practice, this is important for you and your patients. So a tip I would give for you in the business process category is really look at your clinical documentation. This goes right back to the clinical protocol of what are you recording when you're doing your periodontal assessment. So making sure that you have documented a diagnosis in the clinical notes. You have any relevant medical history risk factors that would collaborate with would coincide with periodontal disease or be a comorbidity with periodontal disease. So do they have diabetes? Do they have a past history of a stroke? Do they have a family history of dementia? Like things like that are risk factors that are very relevant. So have that in their clinical notes. Have a diagnosis in the clinical notes, staging and grading in the clinical notes. Make sure that your periodontal charting is extremely complete and detailed, and that your x-rays are of diagnostic quality. If you're diagnosing that there's, periodontal disease and there's bone loss, you need to be able to see that bone loss on the x-rays. If you can't see the bone level at all, if it's cut off at the teeth, then that is not an x-ray of diagnostic quality. So from a business process standpoint, my tip for you is work with your team and really come up with a list of things that must be documented in the patient chart and in the clinical note that will support whatever it is that whatever treatment you're rendering that will support that claim and that diagnosis. This goes for restorative as well. So hygienists, if you're working with your doctor and they're doing a restorative treatment plan, make sure that there's a diagnosis of there's decay around the number 14 crown. That's why it needs to be replaced. Make sure there's a radiograph there, and if there's any way possible, you can see that decay on that radiograph that is illustrated there. So this is true for hygiene procedures and for doctor procedures as well. The other tip that I will give you in the business process area that is really a challenge for dental practices across the country right now is scheduling. Probably 50% of the practice owners that I speak with now are having to schedule patients out 3 to 4 months or more. And we've done a whole episode on this in one of our early seasons. So go back and listen to that. I believe it's in season 1 where we talk about scheduling, is really start to get a handle on your scheduling. Figure out what strategies you can utilize to open up time on your schedule, whether that is expanding hygiene hours, whether that is going out of network with a plan that you no longer fits your practice, whether that is expanding the practice physically, the facility, whether that is utilizing assisted hygiene. There are so many ways that you can do this, and there are great resources out there for hiring and for really, addressing this scheduling backlog that so many teams have, because it is holding back diagnosis and clinical treatment for patients. And then last, we'll talk about metrics. Metrics is a key piece of this inspired hygiene system, because anything that you implement, anything you're working on improving, you must measure to see how it's working. It's one thing, and I've seen this happen in teams so many times. They say, "Yeah, we've been working on that. We've talked about doing more, fluoride or adding a different procedure into our service mix, but we really have no idea. Like, is that working?" And it's because they're not measuring. They're not using metrics. There's a lot of different terms for this. It's tracking, it's KPIs, it's metrics. They're essentially when teams don't look at the thing that they're working on to improve, when they don't measure it to see how it's changing, then they don't know if what they're doing is working. So then they're just doing more of the same without even knowing if that's having an impact. So I'll give you a couple tips on this. Key metrics to track for hygiene. Number 1 is perio percentage. And another one is utilization. So what percentage of the time that you have available for patient care is being utilized by patient care? So if you have 80 hours a week in your practice, are 60 of those are there patients in 60 of those 80 hygiene hours, or are there 75 of those hours being used for patient care? Utilization, the flip side, sometimes we talk about is open time, right? So utilization is what percentage of our time are we using for patient care? Open time is how much of that time was not used for patient care. So it's the same metric, just one side of that coin or the other. The other thing that is really being challenged right now, the other key metric, is hygiene profitability. So we did a whole episode on that also earlier in season 1 that I would encourage you to go back to. We talk a lot about all of these metrics in detail. But I'm going to give you one tip is you can have a perio percentage of 20% or greater and think that you are doing fantastic. But one thing I would encourage you to do is break that down. Look at by the month in that perio, in those perio procedures, how many quads of scaling or root planing are you doing compared to how many perio maintenance procedures are you doing? So if you're at 20% or 25% perio, that's a decent number. Our goal is 35% or more, but 25% is very respectable. So if you look though over the course of the last 6 months and you see, gosh, yeah, we're doing 60 perio maintenance procedures, but we're only doing 8 quads of scaling and root planing, then there's something there to look at. Your perio percentage is being carried by your perio maintenance. So just a tip on that metrics piece that you can really look at and very, very much take action on that and see where you stand. Here's the thing with metrics. Oftentimes, team members get nervous when they know certain things are getting tracked. But here's the thing. You can't celebrate unless you know that things are progressing. It's not about perfection. It's not about um, making somebody wrong. It's about seeing the fruit of your labor. It's about seeing, just like with patients, we do a pre therapy perio evaluation, and we need to be doing a complete post therapy periodontal evaluation, and then showing the patient, look how far you've come, right? It confirms the work that the patient has done. It confirms the investment that they have made. The same thing is true with practice metrics. Hygienists, if you've been putting a lot of effort into having these conversations with your patients, teeing up treatment for doctors, presenting periodontal therapy when you see active periodontal disease, you're never going to know if what you're doing is working unless you measure. So the measurements allow you to see your progress. They also allow you to see where you may want to focus in and develop your skills further, right? So if you say, gosh, I'm presenting this treatment, but it's not showing up in my completed quadsoscalar root planing, then let's take a look at that, right? Are the patients falling through the cracks somewhere in the scheduling process? Are we presenting it and they're just not saying yes? Are we telling the patients we're going to do a predetermination and call them back, and then they've lost any motivation at that point? Like, there are so many points along the process that we can analyze if the metrics aren't showing us what we expect and what we want. So, thank you. This was a great kind of speed 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 dating round of going through the Inspired Hygiene system. But I love to just be able to share with you a little bit of insight, some tips, some actionable steps that you can take on each of these pieces of the system, because this is really what it takes, what we have seen over and over and over for 20 years plus, of what it takes for teams to see transformation in the hygiene department, for them to see in significant clinical outcomes with their patients, and to really reduce their stress because they have more consistency, they have more support, they have more structure around them, and just ways to support them and being the best that they can be. So love to hear your feedback on this. Send us any of your questions. Make some comments. We're going to post this on social. We'd love to hear from you there as well. And just hope you enjoyed learning a little bit about the Inspired Hygiene System. Thank you so much for listening to this episode of the Inspired Hygiene Podcast. We hope you got a ton of value and some things that you can really take away and implement now. So as always, we invite you, if we can help you in any way to optimize your hygiene department, head on over to InspiredHygiene.com. And as always, stay inspired.